Welcome, everyone. Today, we are going to discuss balancing reproductive hormones, an important issue. Sex hormones are not only for our sexuality, but also have a huge impact on our whole body. And so we want to get it right. And anyone who's had a reproductive hormone imbalance can testify to this, that it doesn't just affect your sexuality, but it affects your whole body, energy levels, weight gain, and other areas of the body as well, water retention, etc. So we want to get a handle on this. I've spoke a little bit during the pre-call that I'm not just going to give you a list of things that you can easily Google, right? Like a list of herbs to support estrogen or foods, because you can just search for those. Instead, what I'm hoping to impart to you is an understanding and a sort of how hormones are related to each other, and give you the tools that you can use to easily figure out what it is that you need to figure out, or even just point to where the imbalances are really coming from. So that's my my real goal in this in today's presentation. So with that, let's get started. My name is John Immel. I'm the director of the Joyful Belly School of Ayurveda. And today's talk is sponsored by the herbalism course, the Ayurvedic herbalism course at Joyful Belly, which is an intense, clinically oriented herbal course that covers Western materia medica, in other words, the Western herbs, Ayurvedic methodology, Ayurveda's approach to Western herbs, and also traditional Chinese medicine approach to Western herbs. So we're getting familiar herbs, using them in a clinical setting, and applying these ancient traditions to that, so that we have this holistic understanding of the herbs, and not just using herbs as a replacement to a pharmaceutical. Okay, well, with that, I want to just get right into our topic. So, first of all, anyone whose hormones they feel their hormones are out of whack, or or they seem to have sort of mysterious hormonal swings, anything from hot flashes, even PCOS, painful menstruation. Just in general, what we want to do is make sure the ground is good, and so we want to understand how hormones are processed in the body, and what affects them, just on a very general level, and we'll start there. So most hormones are processed by the liver. In other words, if an organ in your body releases hormones, your liver eventually clears that hormone from the blood and metabolizes it. So anyone who has a weak liver is susceptible to hormone imbalances, that they might get spikes and or dips, or just dysregulation of hormones. So we're always going to be looking at the liver whenever we see any kind of hormone dysregulation. And there, again, many different kinds of herbs that can either act to cleanse the liver or to tonify the liver. Everyone always, whenever anyone thinks about helping their liver, the first thing that comes into mind are all of the liver cleanse fads that they've heard about. But as often as not, livers need strengthening, not just cleansing. So we want to know how to tonify the liver, how to strengthen the liver, how to protect the liver, not just cleanse it. Right? If the liver's tired, cleansing it makes it more tired. It's like whipping a tired horse, right? It's not, the horse may leap forward for a minute or two, but then if it's exhausted, the horse is never going to put out what the same level that it could if it was properly given rest and strengthened. So we want to just remember that in general, that we're not just trying to cleanse something, that we also may need to strengthen it, despite what a lot of health and wellness fads may tell you, right? Okay, the second thing is any kind of toxicity in the body. Ayurveda uses the word ama to talk about toxins in the body, and toxins are not just preservatives that you ate in your food, or chemicals from the nearby factory that you might be breathing into your lungs. Those are toxins for sure. But more often than not, toxins are produced by our own body, right? In other words, or by an improper diet. So if a person has chronic inflammation, there's lots of inflammatory molecules that your body is going to be releasing, and those are toxic to your body. They help it on some level too, but they're also toxic on another level. So we need to clear those inflammatory markers. If a person has bad digestion, gas and bloating, that means there's a lot of, there's SIBO, lots of fermentation in the gut, and that's going to cause a buildup of toxins, and that's going to mess up, because your liver has to process toxins. It's going to weaken the liver, and then your liver's not going to be able to process hormones as well. Also, AMA just causes dysregulation on many levels, from stress and adrenals all the way to dysregulation of the organs that produce those hormones, whether it's the pituitary or the ovaries or the testicles, etc. So AMA in general, toxins in the body, whether they're metabolic byproducts, whether you have high blood sugar from eating too much sugary foods and developing insulin resistance, or whether it is from pollutants and external environment, those toxins can come in many forms, but whatever form it comes in, it's going to weaken your liver. That's the issue there. Okay. And the third thing we're going to look at in terms of the ground, the base that we're dealing with is stress. So how are we managing stress? And everyone always loves to talk about stress reduction. And I think that it is possible to reduce some stress, but far more often, people are stressed because they don't want to, because something is really important to them that they don't want to let go of. And it could be a mom who needs to work a job and take care of her kids, right? What are you going to say? Reduce your stress, quit your job? Well, how's that going to work for the person? That may not be possible. And it may, do less caretaking of your kids. Well, is that what the mom wants to do, is take care of their kids less? Well, maybe she wants to, but maybe they need her care, right? So stress reduction is sometimes possible. Sometimes we can lean on others to help take the burden off of us. And certainly where we can, that can be desirable. But far more often, it's our approach to health that makes us unhealthy. So if we develop stress coping strategies, there's where you can, almost everyone can make a lot of headway. As opposed to stress reduction, sometimes that's difficult. Sometimes it's possible. So I'm not going to go into all of the intricacies of the terrain, the ground, the underlying conditions that are non-hormone related, but are affecting hormones. I just want to say them so that you can remember that those need attention. And then in other presentations, we'll go into depth in those very interesting, very important areas. So we have things like adaptogens, like ashwagandha to help us with stress, other adrenal tonics, from ginseng to rhodiola, right? Also, those are adaptogens. We have alteratives that clean up blood chemistry, hepatoprotectives that protect the liver tonics. We also have detoxicants that will help detoxify the lymphatic system. All those are important. I could add to this list, right? Cholagogues are another important one. You don't need to, memorize those, but if any, cholagogues are what you use to cleanse the liver. They purge the liver. So if any of those look interesting to you, just write the word down, right? Have a piece of paper and a pencil handy during this talk. Write down the interesting words. Check it out. Research it. Look right on Joyful Belly. You can find lists of herbs that with these properties right on Joyful Belly. Okay. All right. That's the terrain. That's the ground. That's constitution. Let's first then make our first leap into the reproductive hormone systems by considering fertility hormones versus pregnancy hormones. Okay, so when you get pregnant, your body doesn't want to get pregnant twice at the same time, right? You don't want to have like a baby that's that you've been growing for 4 months, and then you conceive again before the other baby is done, right? That's your body does not want that to happen. So what does this boil down to? It means that pregnancy hormones suppress fertility hormones. That's a really important concept, because a lot of the reproductive problems have to do with pregnancy hormones getting in the way of fertility hormones when you're not pregnant, or fertility hormones being too high generally. So we can have our hormones low across the board, or we could have high pregnancy hormones and low fertility hormones, or high fertility hormones and really low pregnancy hormones. And all of those are the different ways that that your body can get out of whack. Let's consider a light period, or perhaps even an infertile period. An infertile period could be high pregnancy hormones or low fertility. So if you're having trouble conceiving, it may not be the case that your estrogen is too low. It could be that your progesterone is too high, right? That kind of thinking, or even oxytocin or prolactin. Usually, in fact, people with PCOS can have high prolactin or oxytocin that will suppress their fertility, and then they'll have trouble conceiving. So it's important to consider, is this a fertility hormone that's out of whack, or a pregnancy hormone that's out of whack? And for clinicians, right, if you have this condition, you might have studied all these hormones. But if you're a clinician and you haven't had the condition, this is important information for you to think about. Is it the pregnancy hormone suppressing the fertility hormones, or are the fertility hormones just way too dominant and the pregnancy hormones are too low? Right, so a heavy period can be pregnancy hormones are too low. Think about this. As you move towards ovulation, estrogen increases, and that causes a thickening and buildup of the endometrium, the walls of the uterus. And if those walls keep getting thicker and keep building and building, then you're going to have a heavy period at the end of your cycle, right? But instead, what typically happens, or what's supposed to happen, is that after ovulation, you have the corpus luteum that forms in the ovary. It's kind of like a flower. It kind of looks like a flower, and it opens up and it starts producing progesterone. And that progesterone causes a shift in the uterine muscle from growing and building to developing. And what will happen is that the walls of the uterus will develop many crypts and invaginations where a fertilized egg could attach. And so the estrogen is not decreased, but the rise in progesterone causes the uterine wall to stop growing and start developing. And that development, in the end, instead of building, gives you a normal period instead of a very heavy period. So if a person has a very heavy period, they could be estrogen dominant, or they could be progesterone insufficient. Okay, does that make sense? So we're going to be looking again at pregnancy versus fertility hormones. One thing I want to mention is that even from a biocharacteristics point of view, right, what makes Ayurveda, Chinese medicine, and Greek medicine different from modern medicine is that they look at biocharacteristics, the general pharmacological effect of things on your whole body. So fertility hormones tend to be cold and wet. Estrogen causes water retention and weight gain. And pregnancy hormones tend to be hot and dry. If you've ever gotten pregnant, the first thing you'll notice is that you feel hotter. Your heart rate goes up. You can actually, a practitioner can feel the difference in your pulse if they take your pulse on the wrist. And it's a quite dramatic difference, actually. The pulse feels slippery and bounding. So pregnancy hormones, hot and dry, fertility hormones, cold and wet. Bit opposite there, okay? All right. All right, let's look at the next factor. Weight. So weight kind of belongs in this category of the terrain, right? What is the person's constitution and how is that constitution affecting hormones? So there's a bit of a problem with being overweight and estrogen dominance. And the problem is this, that they cause each other, that an estrogen dominant person tends to gain weight and weight tends to create estrogen dominance. And it happens through aromatase, this enzyme that converts progesterone and testosterone into estrogen. So when men are overweight and are producing aromatase, their testosterone drops. And that's a problem for them. When women are overweight, their estrogen goes up, and that causes them to gain more weight. And it's a bit of a vicious cycle there. So, so we want to look at weight gain as an important factor in estrogen dominance. What is estrogen dominance? Estrogen dominance means not so much that estrogen is high, but that the balance of fertility to pregnancy hormones is off, such that relative to that the fertility hormones are too high relative to the pregnancy hormones. And so estrogen is dominating over the pregnancy hormones. Okay. Aromatase inhibitors then are foods, and there are many of them. You can see this list on Joyful Belly of aromatase inhibitors. I'll put the link right in the chat, but it has a nice list of foods that inhibit aromatase, and that is going to help a person who is producing too much estrogen in their fat tissue to reduce it, to bring those levels back down to normal. Let me just stick that link in the chat just so everyone can see that.
Is it possible to ask a quick question on the aromatase?
Yeah.
If you are postmenopause medical and you don't have any of these hormones in your body per se, do the aromatase inhibitors have a negative effect on that or in the imbalance?
Yeah, so after menopause, the ovaries no longer produce estrogen, but the adrenals and fat tissue continue to produce estrogen. So so after menopause, the estrogen doesn't drop to zero, but it becomes, the levels of estrogen become more similar to a man's estrogen level. And so you can encourage the continued production of estrogen by through these ways, through the adrenals, through fat tissue, and also, in other words, after estrogen drops, a person tends to lose weight, and so they can, and throughout their reproductive years, maybe they were trying to lose weight and dieting and trying to keep their weight really low, but in menopause, that's going to cause their menopause to be more severe, and then their postmenopause to be more dry. So what you want to do is not attack your weight with a vengeance during your reproductive years, and also after you go through menopause. We're not trying to get rid of every ounce of fat we have, because that's going to get rid of estrogen that may be needed in your constitution. And this is also true, by the way, for people who are trying to conceive. I can't tell you how many people in the community and also that I see in clinic who are trying to conceive while they are on a strict diet. And they're trying to lose weight and be trim because everyone is telling them that's really healthy. But we have to remember that that's going to cause fertility hormones to drop when you're losing weight. And so if you're trying to conceive, unless you're obese or have real pathological weight gain, I wouldn't try to get rid of that last inch in the abdomen if you're having trouble conceiving. But instead, just let your body naturally do its thing, eat healthy, but not not any intense dieting, because it will cause fertility hormones to drop. All right, good. I saw someone mention there were some sound issues. Did that resolve? Everyone can hear? I see some others saying they can hear. Great. Wendy is asking if we should have our estrogen levels tested before changing your diet. It's never a bad idea to have things tested. But that's one of the things I love about Western medicine is you just get these very specific tests on specific levels in your body. Super helpful. Helpful for your alternative health and wellness practitioner, helpful for the doctor, helpful for you. Yeah, testing is never, why not to get tested? And the money is the only reason typically why you wouldn't get a test.
Quick question. So, sorry. So on this test, about this testing thing, so if, is there a range that, I guess, is there like the Ayurvedic range, which is different from like the Western medicine range in terms of, because they say sometimes if your estrogen is a certain level, they say it's okay, but like, is there something like maybe it's actually higher or it shows
Well,
dominance?
my rule of thumb in all of those is that if I see a client is approaching the cutoff range, I'm going to start addressing it. I'm not going to wait until it crosses the line, and that's true whether it's thyroid hormones or estrogen or whatever. I mean, and those are things that if you're wondering about that, I would simply Google the reference ranges for whatever hormone you're testing, and see if you're starting to approach one of the either the high end or the low end, and I usually just go by that. I don't think that there's not. I may do a little more research than that on the particular hormone in a particular situation.
Okay, thank you.
Yeah, that's the thing. Helen is saying everyone says different numbers, right? Well, you're not just going to rely on a number. Like, how do you feel? What are the symptoms, right? If you are showing all these signs of hypothyroid, but you're above the threshold, I would address it.
And could those blood test results also indicate like dominance in terms of like if estrogen is higher, but it's still normal, and testosterone is also in the normal range, but it's just that there's more estrogen, that means dominance?
Yeah, sometimes estrogen dominant symptoms appear even though the hormone levels look normal, but that maybe the body is, you might say, estrogen sensitive, right? Some people are more sensitive to estrogen. Their estrogen receptors are more sensitive for whatever reason. That happens too. So it's not just the levels, but it's also your body's sensitivity to, to the hormones. And that, so that's why it's not just about the levels. You have to look at symptoms.
Got it. Thank you.
Yeah. And that's true for all cortisol. You can be sensitive to cortisol, a stress hormone. You could be sensitive to, you could be insensitive to insulin. That's insulin resistance. So any of these hormones, you can be sensitive or insensitive to them.
So would the free hormone levels determine, I guess the difference between the free hormones and the hormones themselves determine sensitivity? Or...
No, it's literally like you could just have the exact same amount of hormones as somebody else, and the person, one person is just more easily stimulated by that level.
Okay, makes sense.
Yeah.
Thanks.
Okay, great. So I'll move forward now. So fat increases estrogen, and aromatase inhibitors can help break that process. Men can take aromatase inhibitors to keep testosterone high, and women can take aromatase inhibitors to prevent estrogen from getting too high. All right, now let's look at PCOS versus estrogen dominance. All right, actually, before no, good. Well, I'll start with this one. Okay, so PCOS, polycystic ovarian syndrome, tends to be a case of having high prolactin or high testosterone. So if you're a woman and your testosterone levels are too high, that's problematic because you'll start to develop male characteristics like facial hair, or hirsutism is a common one. But also what will happen is your body may produce too much prolactin that will suppress fertility. People who have PCOS can have a harder time conceiving. So on some level, you could say estrogen dominance is having too much of the female hormones, but PCOS is sort of having too much of the male hormones or the fertility hormones. So in PCOS, you can try to depress testosterone as well as prolactin with dopaminergic herbs. I'll put that link into the chat here. Again, I'm not going to go through the whole list because the list is on Joyful Belly. You can also Google it, but I want to key you in to the important factors here. Is that generally testosterone and prolactin are high when the pituitary gland is overstimulated. The pituitary gland is a gland in your central nervous system, in your brain actually, or just beneath your brain, and it signals the adrenals, the thyroid, the reproductive organs, and sometimes an overstimulated pituitary can cause high testosterone, high prolactin, and so if you can take an herb that's relaxing, it will depress relaxing or mood lifting, it will depress those hormones, testosterone and prolactin. That's what dopaminergic herbs do. Have you ever heard don't take mint while you're breastfeeding? It seems like mint would be just this great tea. But if you take a lot of mint while you're breastfeeding, your milk will dry up. And the reason is because many mint family herbs are dopaminergic. They and that reduces stimulation of the pituitary, which lowers your prolactin. Lactin, the word lactin just means milk. So prolactin is your pro-milk hormone, right? So if you lower prolactin, you are going to, your breast milk will dry up. If you have PCOS and you have too much reproductive pregnancy hormones or too much testosterone, reducing stimulation of the pituitary can help correct that. Okay, great. Then we can also look at uterine tone. So oxytocin, you may have heard of oxytocin. Sometimes it's called the tendon befriend hormone, but I like to call it the tribal hormone because you get more friendly with the people that are close to you, but more hostile to the people that are further away from you. It's not just this lovey-dovey affection hormone. It's also a hostile to people outside your tribe, right? People who, it's more, I like to, I think of oxytocin as the polarizing hormone. It is the hormone that polarizes people, makes them more affectionate to what they like and more hostile to what they don't. And so oxytocin can it increases during pregnancy. And if you've ever been pregnant, you might have noticed this, that you became, maybe just a little more tribal, a little bit more, protective of your inner circle, and a little more isolated from the folks that sort of rub you the wrong way. That you may have noticed that trend. But yeah, so oxytocin also stimulates the uterus and can cause uterine contractions. In fact, increase in oxytocin helps you deliver the baby. After postpartum, after the baby is delivered, postpartum herbs are often included, and they are typically oxytocic and help the uterus contract back down to its pre-pregnancy size. Right, so you can take antispasmodics that relax the uterus, if you have too much uterine cramping, or if you need to prepare for birth and delivery, you might start taking oxytocin herbs. And I just put those two links right in there. And then lastly, we also might consider anti-discharge herbs. If you're having discharge due to yeast infection, you can look at antimicrobials and antifungals, also clearing ama and other things. But there's also a whole group of herbs that are anti-discharge herbs and can help dry up a discharge and also tone the muscle so that it becomes less leaky, you might say. I am, sort of not discussing that in a specific anatomical way, but just a sort of general way. Like if you astringe tissue, you will dry it up. And that's what these anti-discharge herbs do. They tend to be astringent. All right, I just want to review. We have pregnancy and fertility hormones. High fertility hormones or high testosterone can look a little bit like PCOS. It can also suppress fertility. And high estrogen is estrogen dominance. That's where you get the lumps in the breast. You start to get water retention. You will put on weight with estrogen dominance. And so that's why during at certain stages of the cycle, a woman might have more water retention than at other stages. And that's because of estrogen. All right. And when we are trying to reduce prolactin, testosterone, LH, or FSH, all these other hormones that are whose production is stimulated by the pituitary, what we want to do is relax the pituitary, and dopaminergic herbs can help with that process. Why would the pituitary get overstimulated? Well, one person in the chat was talking about getting a head injury that put a lot of stress on the pituitary. But typically, a typical culprit of overstimulated pituitary gland is hypothyroid. Here's what happens. If your thyroid is not producing enough thyroid hormones, then your pituitary starts to work overtime to stimulate the thyroid gland. In fact, the pituitary will overproduce TSH, it's called thyroid stimulating hormone. And so if that's happening, if your thyroid is low, that makes the pituitary get overstimulated. And once the pituitary is overstimulated, it will hyperproduce prolactin, testosterone, LH, and FSH. So if a person gets hypothyroid, it can predispose them to PCOS. So we want to, if you have PCOS, you want to address the thyroid also. In general, PCOS is just a very kapha disorder. So we're going to look to increase metabolism and decrease kapha. If you know what that means, not everyone here has studied Ayurveda. Kapha is the constitution, the body type that tends towards congestion, weight gain, fluid retention, and just general wateriness and excess. All right, great. Great. I want to talk a little bit about the characteristics of, oh, that's not the link I wanted. Let's see if I can get there. There we go. Yeah.
John, can I ask a quick question about the antispasmatic?
Yes. Mm-hmm. Yep.
You said that relaxes the uterus. In postmenopausal women, there can be the atrophic vaginitis or the dryness. Would those be good herbs for helping pelvic pain during intercourse, dry uterus, atrophic vaginitis?
Pelvic pain during intercourse could be due to several different factors. All the antispasmodics are going to do is relax the muscle. That's what they do. So if the pain is caused by muscle cramping, antispasmodics will help. If it's caused by other factors, such as irritation due to the dryness or other things like that, then the antispasmodics won't help. In that case, what you would want is something maybe like a demulcent to encourage estrogen to moisten the lining of the vaginal wall, but also demulcents that that will just encourage all mucous membranes to produce a little bit more protective mucus layer. So yeah, and the word there is demulcent. I'll type it in. You can you can search on Joyful Belly for for that word. Okay. All right, I'm just going to go through quickly the biocharacteristics of the different hormones. Testosterone tends to be hot, moist, and heavy. Moist is a synonym in Ayurveda for building. So we know this. You take testosterone, it builds up your muscles. It's anabolic. Testosterone is a male sex hormone. It's an anabolic muscle builder. Estrogen is also an anabolic muscle builder. So if you have muscle wasting, then these sex hormones, testosterone and estrogen, will help build muscle tissue. All right. I talked about symptoms of excess estrogen already, and deficient estrogen are just the symptoms of menopause, right? Light period or no period, dryness, low libido, and bone loss. Okay, progesterone is hot, dry, and relaxing. Anyone get varicose veins during pregnancy? That happens because progesterone rises, which relaxes smooth muscle tissue and causes all of the veins to dilate. And once they dilate, they don't move the blood as well. So there's lots of because blood's a fluid, right? It ends up the veins end up collecting more fluid in them, which puts a lot of pressure on the veins around your ankles and in the legs. And then the vessel gets distended, and that's what we understand as varicose veins. That happens due to high progesterone during pregnancy. If a person has excess progesterone, they'll get a light or delayed period. The period won't come as often because the progesterone maintains the uterine wall longer. That's what the progesterone does. It maintains the uterine wall during pregnancy and relaxes muscles. So if a person has excess progesterone, they're going to have long periods, long menstrual cycles. So it could be a 32-day cycle instead of a 28-day cycle. Or the period may be very light because estrogen doesn't have a chance to build up the uterine wall. Oxytocin, I mentioned a little bit about this already, that oxytocin is a polarizing hormone. It increases bonding with your baby and the people you love, but it can create hostility towards people who are outside the inner circle, people with different opinions, cultures, or beliefs. Oxytocin is anabolic to muscle and bone, but causes weight loss. It also causes the letdown reflex. So it's oxytocin that causes the milk to let down during nursing. That's why you see, even if a farmer is milking a cow, they always rub the uterus, the udder. They rub the udder a bit to get the milk to drop in the cow before they milk it. And the same thing with the baby. Nipple stimulation or the baby rubbing the breast in any way will cause the letdown reflex. Also, the baby crying will cause the letdown reflex. But sometimes people who aren't pregnant have excess oxytocin. And that's true if a person's taking hormonal birth control. Prolactin and oxytocin will both be high. And that can cause problems at once with fertility after the person gets off the pill. All right, prolactin, I mentioned earlier. Also, prolactin increases production of milk and suppresses reproductive hormones. It's also stimulated and increased by pregnancy, nipple stimulation, but also in stress. Stress increases prolactin and birth control, pituitary stimulation I mentioned before. That's why dopaminergic herbs help balance prolactin. Okay, so this is a very sort of biochemistry kind of presentation, right? I've given you the sort of broad overview, and I'm going to let you as individuals look at the particular lists of galactagogues and or oxytocin herbs or estrogenic herbs and foods. If you click on these links here, I'm just going to show you how to use these lists because it is very constitution dependent. First of all, you'll see videos where I've given a more expansive presentation on estrogen, and so go through, watch that if you feel like you need to know more about estrogen. But if you jump down here, you'll see these ingredients with estrogenic quality. Take a look here. If you know your constitution, you can see that these herbs and foods, dietary recommendations are sorted by dosha. So if you're like, I'm a kapha person and I need to reduce estrogen, or maybe sage is going to be your top herb here. You can also look at the biocharacteristics of these suggestions. Also, you can look at other herbal actions. Like, I need an anti-inflammatory that's also estrogenic. What are my estrogenic anti-inflammatories? So you can take a look at that. Great. Thank you, Ashlyn, for answering some of those questions in the chat. I appreciate that. So go follow those links and you can find information that will help you get to the right herb that's going to be the good one for your constitution. That's a little legwork for you. But if you ask me to say, well, which herb is the best herb? I'm going to give you the classic Ayurvedic answer. I'm going to say, well, who's asking, right? I'm going to say, what's your constitution? What's your circumstances? Ayurveda is very individualistic. Any general answer I can give, you could easily find that by Googling. It's the specific individual answers that make Ayurveda great. So that can be, you can achieve that through a consultation with an Ayurveda practitioner, but also Joyful Belly provides a lot of online information to help you sort some of that out if you have the time to sort out some of that. But again, a basic overview. Here's all the links. Let me see if I can just paste this whole thing right in there. Testosteronic herbs, aromatase inhibitors, anti-estrogens, dopaminergic herbs. I can put those links right in the chat there, so you have them. Let's see here. Anti-androgen and dopaminergic. All right, so Kelly's asking a question now. She's saying, what if I'm getting hot flashes? So what we need to do is understand a little bit about the pathogenesis of hot flashes. What typically happens is that estrogen is low during menopause, and then it can spike occasionally, especially during perimenopause or just after menopause. If you're near the time of menopause, then hormone levels can fluctuate. So when when estrogen levels are low, the body is cold. When estrogen levels are high, the body gets warm. Estrogen is makes the person warm. So after menopause, temperature levels drop. So if a person's in perimenopause and hormone levels are fluctuating, then when estrogen goes high, it's like when your fever is rising. Have you ever gotten a fever? And when your temperature is going up, you get chills. And you're like, wait a second, why am I getting chills? Because my temperature is going up. And it's because your body produces when your body feels like it's too cold for where it wants to be, you get the chills. Then when your fever drops again, you break out into a sweat, right? So the same is happening here with hot flashes. If estrogen's high for a period of time and then it drops, the person feels like they're breaking a sweat as when a fever goes down. And so to make a long story short, it's caused by fluctuating estrogen levels. And so what you want to do there is, one, make sure the ground is not causing dysregulation. Is there AMA? Is there liver pathology? Is the liver weak in any way? Is there any way you can help the liver clear hormones so that the levels aren't fluctuating and your body is self-regulating better? Then you can take estrogenic herbs and foods, or use some of the other strategies that we mentioned in order to encourage slightly higher levels of estrogen, and that can help keep the body just a little bit more stable. So it's not it's not dropping as much due to the just the dysregulation during the perimenopausal time period. One thing which I'll say about estrogenic herbs, which I find very fascinating, is that most estrogenic herbs are amphoteric, which means they work in both directions. They can increase estrogen when estrogen is low, and they decrease estrogen when estrogen is high. And the reason for this is because they compete with estrogen receptors. So if you don't have enough estrogen, you have plenty of free and available estrogen receptors, and the herb stimulates those estrogen receptors. It doesn't stimulate it as well as estrogen, but it does stimulate it. Okay, now what happens in the case when you have estrogen dominance and you take an estrogenic herb? Well, typically what happens then is that some of these phytoestrogens, the plant-based estrogens, compete with your body's estrogen for the estrogen receptors, but they don't stimulate it as well. In other words, if you had 100 estrogen receptors and they're all binded by your body's estrogen, you might have 100, your level of estrogen may be 100, right? Or 100%. But if half of those estrogen receptors were used up by the phytoestrogen, and the phytoestrogen doesn't stimulate it as well, you're going to get 50% of your estrogen receptors are only going to output half the level of estrogen, and it effectively brings down estrogen. That is a fascinating thing to me, that estrogenic herbs can bring down estrogen levels when they're too high, and they can help raise it when estrogen levels are too low. So if you are looking to improve estrogen stability during hot flashes, those estrogenic herbs are probably going to be the right fit. But of course, you have to know the individual, right? We have to look at the individual and see what more we can say. All right, so aromatase, Kelly, will help produce more estrogen. So if estrogen levels are low, that's a good thing. If estrogen levels are too high, that's not good. You want aromatase inhibitors to decrease estrogen dominance. There we go. See, Wendy is saying, as part of my breast cancer treatment, I take letrozole, an estrogen inhibitor. I can't take estrogen as my breast cancer was estrogen dominant. Ideas? So, Wendy, what I would say is, in that case, yeah, you're not going to take something that's going to increase estrogen in your body if you are prone to breast cancer or any kind of what we would call congestive blood disorders, which estrogen tends to create. So in that case, I would go at the problem indirectly. what is the ground? How are your stress levels? How is toxicity levels in the body? How is your liver doing? If we work on those, we'll improve your body's ability to regulate and let the body do its thing. So that's where I would go with that. If you were trying to improve the effect of the letrozole, but you have to ask your doctor about this, right? Because your doctor has dosed you according to, where your levels were at. If you start doing things like taking aromatase inhibitors and other things to depress estrogen, it might overdo it. And then you might need to adjust your dose of medicine, etc. So, so those are some strategies and approaches that I would use for that. All right, let's see here. I see that Ashlyn is helping me out here by getting me the list of questions from the chat. Thank you, Ashlyn. Appreciate that. Let me pull those up and answer them one in turn. How safe is short-term progesterone therapy and perimenopause and natural alternatives to switch over? History of chronic migraine and period flu symptoms, as well as cycle-related difficulties. So one thing, Tina, which I'll mention to you, is that we can jump over on Joyful Belly. You can get a you can see that. Let's see if I can. There we go. Premenstrual syndrome, PMS. So I have a whole page on here that talks a little bit about PMS and some of the different types, because there's not just one type of PMS. So there's PMS blood congestion, which is uterine congestion as estrogen overstimulates growth of the endometrium. And then there's lots of heaviness, achiness, back pain due to the swelling and retention of fluids in that area. That's all estrogen dominant type. All right, and if you have fluid retention, diuretics may help release some of that. And you can see here some herbs and stuff that are mentioned. If there's PMS headaches, chaste tree and black cohosh are specific for PMS headaches. But if it's a migraine type headache, consider alternatives for the liver as well. If it's mood swings that are dominant, think about nervines and nerve tropho-restoratives. You can get those links on Joyful Belly. Depression, dopaminergic herbs. And if there's PMS acne, that tends to be more, teenagers. That could be related to high testosterone. So you may consider clearing some testosterone with anti-androgens, alteratives, cleansing toxins, supporting the liver. So that addresses some of the migraine and period flu symptoms. As far as safety of short-term progesterone therapy and perimenopause, I don't have a comment on that. If there's someone on the call who wishes to contribute their knowledge of the safety of short-term progesterone therapy, please do. Please feel free to add your wisdom there. All right, Dylan.
Sorry, I just have a quick question.
Yeah.
So I have rheumatoid arthritis, and I am pretty fine until my monthly menstrual cycle comes, and then I end up having flare-ups. So I'm just looking at kind of the list of things that you had there. And by flare-ups, I would mean like I can't, my hands, I can't use them quite the same because of the inflammation. My joints are inflamed. So would that fall under that fluid retention? I'm just trying to understand.
Okay, so there's a lot. This is a pretty typical scenario, is that your body's doing fine with whatever disorder for most of the month, but then during the cycle, the symptoms flare up. And sometimes that's because of some specific hormone imbalance, but typically what it is that your body is able to handle things when it's strong, but then during the cycle, the body gets a little weak, maybe gets a little out of whack in general, just due to the changes in hormones, and that pushes your body over this threshold level. So it's not like that's our RA is flaring up because of a specific hormone imbalance. I mean, maybe there is, but very often it's just that the body can handle a certain amount of stress, and when it gets above that level during the menstrual cycle, by stress I don't mean mental stress, I mean just stress on the body, like stress on your liver or stress on your adrenals or whatever, right? That it just pushes the body over some threshold level. So how do you deal with that? Well, my best answer to that is you just get careful as you're going into your cycle. So yes, we could amp up the dose of immune calming herbs. You can search immune calming on Joyful Belly, and you'll see a list of immune calming herbs, Baikal skullcap or things like that, that could calm the immune system. In RA, you're also going to make sure that there's no toxins in the system. You're going to be definitely helping the liver out, right? Because it could be the combination of your liver trying to clear menstrual hormones, as well as trying to clear low-level inflammation from the RA, and it just can't do it, and the body gets out of whack. So if you help your liver during that time period, or just even in general throughout the month, hepatoprotective like milk thistle, that may work. Again, I don't know your constitution, so it's very hard to me to give specific recommendations. But as far as a strategy, I would be looking at, checking out and assessing the liver, and also what you can do. There's a great book. What's her name now? I think it. What's that book? Woman Code, where she talks about the foods to support each stage of your cycle. It's a pretty cool book by Alyssa Vitti. Thank you, Julia. Yes, that's the one. Alyssa Vitti. Yeah, Claudia Welch also has Balance Your Hormones, Balance Your Life. That's going to give you some great insights by Claudia Welch. Those are some good books. That you can use for follow-up. There you go. Thanks, Ashlyn, for providing that link. I think you'll get some really good ideas from that. All right, Dylan, 33 years old. I've been trying to conceive for over a year and haven't been able to become pregnant yet. My blood work, my husband's semen analysis are normal, so we're experiencing unexplained fertility. My luteal phase is short, 8 to 10 days, which makes me concerned I might have a hormonal imbalance. Well, Dylan, so yeah, as we mentioned earlier, some people are more sensitive. Like it could be that your hormone levels are normal, but you're sensitive to one or other hormone. A short luteal phase tends to be low progesterone. But you said your hormone levels were normal. But typically what happens is that the progesterone levels are too low to sustain the lining of the endometrium, and then the person has their period too soon, and the cycle begins all over again. So yeah, so that tends to be the issue with a short cycle, and why there's trouble conceiving, right? Because if the progesterone is not high enough to develop the uterus as well as to maintain it, then the egg has trouble with implantation. So that could be the issue. Yeah, could be the issue. Allie, my name is Allie. I'm looking to start a family at 31 years old and like to know how to balance hormones to support my fertility and success of conception. So yeah, that you can, there's all kinds of things that Ayurveda recommends to prepare for pregnancy. And I believe on the Joyful Belly YouTube channel, there's a video exactly on that topic. So if you go to the Joyful Belly's YouTube channel and look for that, you'll get a whole beautiful presentation on that and all that you can do. As I said before, if you're trying to boost your fertility, and you're not obese, right? If you're obese, lose weight. That's good. That'll help you. But if you are not obese and you're having trouble conceiving, that it's not a time to go on a diet, right? You want to have that extra, inch to pinch because that fat tissue is going to help produce estrogen for you. All right, Susanna from Mexico, age 43, struggles with digestion, not producing enough stomach acid, and this is taking a toll on my hormones. Interesting, Susanna, the relationship between stomach acid and hormones. I've not studied that relationship, so I'm interested to hear more about it. If you want to put some more info in the chat on it or point me to a link there, that's a great thing. But you said you also have adrenal fatigue, low libido, low energy, hair falling out, etc. You also have high levels of aluminum, which I think that those are all possible. It's beyond the scope of today's presentation for us to, really talk about how to chelate and detox from all that stuff. But I will say general that, maybe a cleanse would help with those high levels of aluminum, and just building diet can help with hair falling, low energy, low libido, and then you have your adaptogens that are also going to be a reproductive tonic. So ashwagandha and shatavari maybe would help your constitution. I just need to know more specific information about you to say that. Yeah, deworming. Arav has asked about deworming, and anytime you have a pathogen, that's going to totally dysregulate your body and your hormones. So yeah, get rid of the pathogens, definitely. Shilajit, someone's asking if Shilajit should be used for hormonal balance. Shilajit's intense. It's very sharp. It's mineral pitch that exudes out of mountain ranges. Shilajit being the Himalayan variety, and it's super sharp and intense. So it has to be the right one for your constitution. I wouldn't just give just because it supports testosterone. I wouldn't just take it regardless of what your constitution is. You have to make sure it's a good fit. Shilajit is pitta provoking, very hot, and also is a strong diuretic, so it can dry out a Vata person. So you just gotta think about it. Also, the warmth can pacify Vata as well. It just depends on the constitution. All right, good. Let's take a few more questions here. Looks like. All right, Natalie from Canada, 32, struggling with rheumatoid arthritis. Okay, I think I asked you asked your question already. B from Silver City here, 38, experiencing low thyroid and curious about hormonal connection. Yeah, so that's what we spoke about, is that low thyroid makes the pituitary gland work overtime to stimulate the thyroid gland. And then that overstimulated pituitary starts producing prolactin, LH, testosterone, and that can predispose a person to PCOS. Great. Want to know how to support, Marissa is wanting to know how to support clients with fertility and infertility. And I would say, check out our YouTube channel, Marissa. We have not just, we have a whole section. It's like 6 hours or something or so of pregnancy, fertility, from fertility to pregnancy to postpartum. I think you'll find it fascinating and benefit a lot from it. Helen, can I take ashwagandha if I have Crohn's disease in the ileum, currently in remission? So ashwagandha is an anti-inflammatory. Does it have any immune stimulating qualities that could aggravate an autoimmune condition? I don't know that it would. You can check that out on the website. It is an anti-inflammatory though. So yeah, I've never heard of it aggravating Crohn's disease, but that doesn't mean it doesn't. I'd have to take a just crack open the books or look at the Joyful Belly page on that. And yeah, can COVID vaccine be carried in the sperm of a partner and affect hormones? That I do not know. What I can say is I know a lot of people who had fertility issues after COVID, and I'm assuming that's due to vascular issues, both whether they had COVID or the COVID vaccine. I don't have the stats in front of me on which is worse, the vaccine or getting COVID itself, but I can say I know a lot of people whose reproductive health was affected by COVID, and I'm assuming that's due to the effect of COVID on the blood. COVID is not just a respiratory disorder. Everyone has to remember that it attacks the blood as well as the lungs. And part of the reason why it looks like a respiratory disorder is because in the process of attacking the lungs, it reduces oxygen transport in the lungs. So you see the person huffing and puffing. It does destroy lung function, but it also destroys oxygen transport, and that also looks like lung function issues. But then, blood and reproduction go hand in hand, right? So if there's problems in the blood, you're going to see problems in reproductive health. Krista, how often do we need to include estrogens like ashwagandha? No, you don't need to include it at all. Nobody needs nobody needs adaptogens. It's not like everyone needs adaptogens, just some people do. So it depends on who you are and how much stress you have and how you deal with it. Stress can actually be extremely healthy for a person if they take it on with joy. If you're like, wow, I get to work through this problem in my life. Wow, I get to be the person that juggles the job and the kids and aging parent, and I'm gonna let this be my rally call to greatness and magnanimity, right? If you take it on with with joy, while not but still keeping a regular meals and all that, just keeping your life organized and in order so that you're not getting depleted, that can be fine. But if you're overwhelmed by your life, even if your life isn't stressful, it's going to be unhealthy for you. I think it's the overwhelm that's unhealthy, not the existence of stressful things. So if developing an adaptogen can help, and also developing great coping strategies, it gets harder as we age. Our stress coping abilities, deteriorate, but also our spiritual awareness increases as we age. So, we have more wisdom. So hopefully we can better handle stress psychologically, if not, even if our nervous system is not as well able. All right, Natosha, how does long-term use birth control affect hormones? It causes fertility problems, and also birth control changes a woman's sexual preferences. So after you get off birth control, there's just issues, right? Sex hormones are not it's not just about conception. This is deep biology here, right? So when you say long-term birth control, I'm assuming you mean hormonal birth control, because I'm not talking about this in regard to non-hormonal birth control. But hormonal birth control goes deep into your whole system. It changes psychology, as I said before, oxytocin levels. It changes your body's weight. It changes sexual preferences. It affects everything. So it's almost easy to answer how does and what are the ways that birth control doesn't affect hormones? It would be probably hard to find one that it doesn't affect, right? It is a hormone. A hormonal birth control is a hormone, so it does affect hormone. After you get off hormones, it can take quite a while for your body to settle down. Almost like a teenager, when they first go through puberty, their hormone levels are sort of in fluctuation. That will happen after you stop birth control as well. Your body's has to manage it and maintain it and rev up those organs again to produce it. So yeah. Can you list all the fertility hormones and pregnancy hormones? Testosterone, estrogen, luteinizing hormone, follicle stimulating hormone, oxytocin. Did I say progesterone? I don't think I did. Progesterone, And did I forget any? Prolactin. Probably I said one or two of those twice. I don't know, I got a little list right there. Yeah, those are the main ones: testosterone, estrogen, progesterone, prolactin, oxytocin, LH, FSH. Yeah, good. Yeah, lots to learn. Lots to learn. It's good stuff. It's good stuff. An adenomyosis cyst. I'm not gonna get into that one right now. Should we have our estrogen levels tested before we change our diet? I answered that one already. How could we increase estrogen levels if they are low after birth? Yeah, so all the ways I mentioned, by not going on a diet, by not eating too many aromatase inhibitors, by taking herbal estrogenic supplements. All right. I think I got them. What herbs and treatments post-menopause to keep the lining of the uterus from thinning? That's where you're going to do your anabolic muscle builders. So ashwagandha, shatavari, your testosteronic, estrogenic herbs will be anabolic and help maintain the muscle tone of the uterus. Oxytocin. If body weight is low and adrenals are tired going into perimenopause, how exactly do we encourage estrogen production? Well, I would try to correct that, Tina, an OJAS building diet to bring the weight up to normal levels. If the adrenals are tired, some adaptogens, develop a contemplative practice. Great. So many people have written so much good stuff about stress coping skills. Take a leadership seminar. Typically leadership seminars do have stuff like that, so you can maybe find some ideas there. Herbal categories that help increase luteal phase. Yeah, so that would be due to the low progesterone. There are progesteronic herbs as well as you can look them up. Shatavari is a progesteronic herb. Chase tree. There's some heavy hitter herbs. Chase tree is an example of one. Black cohosh is another one. But chase tree is a sort of, and Ashoka in Ayurveda. Chase tree and Ashoka are almost like panaceas for hormonal disturbance. So look up chase tree and Ashoka. They're two different herbs. Check it out on Joyful Belly. See if it's a good fit for your constitution, etc. All right, good. I think I got everything. Sarah, some info around fibroids. Fibroids are basically estrogen dominance. For them, of course, there's always exceptions to every rule, but your fibroids tend to be estrogen dominance. Polyps, same thing. Endometriosis, they all tend to be estrogen dominant. Fibroids tend to be more kapha in nature. Endometriosis is more vata pitta. So if you have a hot, dry constitution with estrogen dominance, that tends towards endometriosis. You can look at the statistics on Joyful Belly to confirm this. You can check this out. There's the endometriosis page. If we jump down to the live report, you can see the tendencies for this disorder. Pitta, it tends to be the case that Pitta and Vata are high, and Kapha is much lower on the scale than those other two doshas. So hot and dry individuals with estrogen dominance tend to get endometriosis more. Your Kapha individuals tend to get fibroids more. A long Kapha cycle can be high. But seems to be in Kapha people are the ones that get the long cycle, and it's probably the case that estrogen and progesterone are high. Short cycle, a spotting period, that tends to be low progesterone. If you have no period or a very light period, that tends to be low estrogen or high fertility hormones, prolactin, testosterone, testosterone as well. Yeah, good. Did I answer all the questions? Yeah, Joy Gentle, the uterine polyps. That's again, estrogen dominance. Typically.
I have a question on,
Yeah.
thyroid medications. I've been on one for multiple years, but I don't really feel that it's helping and, for hypothyroidism. And my question is that I've been told that if you don't have the right dosage, it actually works against you and making, kind of like weight loss and your hormones, make it more difficult for things to balance. And is there a way to transition from taking a thyroid medication to a more holistic approach? My challenge with having tried that is, because I'm postmenopausal through medical menopause, my hot flashes come on significantly when I come off the thyroid medicine. And
Very
I'm
important.
confused as to why there's a relationship with that, because I've been told that there should not be.
Yeah, well, one thing I'll say is that if if your thyroid hormones are fluctuating, you will experience heat and cold because high metabolism it makes you hot. So that may be related to just the thyroid itself going up and down, and you feel hot and cold, not just the reproductive hormones. But then what happens is they may just both come together. Anyway, the techniques to address thyroid is just a whole nother topic. I mean, there's some overlap with reproductive hormones, but there's a whole protocol for thyroid. You could check on the Joyful Belly website for our hypothyroid protocol, everything from immune herbs, antivirals. What's that?
No.
Oh, I hear that. I think that's some background noise from somebody. Let me see if I can mute that. Yeah, great. I'll
Thank you.
I want to let all of you know that for the next 24 hours, that we will be offering a $1,250 discount on all of our courses. It's our biggest scholarship that we will offer for taking our Ayurveda certification courses for the whole year. We won't offer that opportunity again. But if any of you were interested in today's call and enjoyed learning this information and believe that you could this could help you, or you're excited about starting a career in alternative health and wellness and getting to understand Ayurveda's approach, how all these things work, not just in the reproductive system, but the nervous system. Vast topic, right? Huge, incredible topic. Those are all just exciting, helpful, and not just for you, but for your whole community. And so if you are interested in studying with us, we'd love to have you. If you are enthusiastic, you'll do well. It's what does it take to know this stuff? It takes high degree of motivation. Our courses are challenging. They're clinically oriented. They're not for the faint of heart, but we make our courses accessible even to very busy individuals. In fact, many of our students, because our students tend to be leaders in their community, they tend to have lots going on in their life. And so we designed the course for you. You can still do this course if you get a high level of training, the high level of training that we offer, and we work with you to make sure that that it fits into a busy life. As I said, most of our students tend to be leaders, and they tend to have a lot going on, and they're looking for not just, they're looking to study the real thing, right? They're looking to study real Ayurveda, not that this is just something that we're gonna play around with, or hey, this will just be a fun thing. It will be fun. It'll be amazing. You will get a lot of inspiration from studying at Joyful Belly. If you take our courses, you could probably hear the passion that I have for figuring this stuff out. and studying it and talking about it with students. And I think all of our students can echo that our programs are inspiring and fascinating and fun. But our courses are serious. We are looking to make excellent clinicians, to bring excellent clinicians out into the public that can help people heal, people who want to serve the community. And so thank you, Lisa. I see, Lisa, you're saying you took our course and it was fantastic. Thank you for that. Rebecca Lee also. Appreciate you saying that. Roxanne and Saveda as well. Appreciate the students who are coming to this talk today to get this information, and I appreciate your feedback. That we will push you in our courses, but we make it accessible for busy people. So if you're excited about this stuff, come and study with us. It'll be a great thing. It's our biggest discount all year, $1,250 off the course. So if you know you want to do it, sign up early. Our courses start in August, and in October, and we will. You won't be sitting idle that whole time. We will give you the pre-course and reading materials and all kinds of things, so that when the day the course starts, you are going to be the best student in the class. That's what happens with our students who register early, is that we give them the information they need so that they have a good background by the time the course starts. And then when the course starts, they're learning, they're reading between the lines, right? While everyone else is catching up with the basics. Now, what's the difference between you and them? You will be reading between the lines, having already gotten the basics. And that's a very exciting thing. Our students who register early are often our best students. So the fee per course depends on the course. Our 2-year program, which gives you all the fundamentals of Ayurveda, that program is $6,999, $3,500 a year, roughly. I mean, how can you get a great education with all the information that you're going to learn in this course for $3,500 a year? Very hard to get that. Very hard to match that. I will share this video, Trish, and then you can get to the pages that you need on it. Not the outline, but I will share the video, and so I'll post that on YouTube. Thanks for asking that. So we have a 1-year course in mastering Ayurvedic digestion and nutrition. That's a specialization course in digestion, where you learn digestion in depth. And digestion is a strong point of Ayurveda, a strength of Ayurveda. So we wanted to make sure that our students who graduate from the 2-year course, or nutritionists, or other people who've been out who have a clinical practice, can get Ayurveda's in-depth advanced treatment of digestive tract disorders. We make that course available, and that's a 1-year course for $4,499. And then our Ayurveda herbal course, I don't know if there are any students in the herb course that are on the call today, but they can tell you that is a really intense, awesome course. And you'll be learning Ayurveda's approach to Western herbs, accessible herbs, as well as all the top Ayurvedic herbs that you can get outside of India, and then you will also get the traditional Chinese medicine approach to herbs. That course will just blow the doors off of anything that it just brings it to a whole new level. So typically people take that course after our 2-year course. Again, we allow individuals who have some kind of existing clinical practice, health and wellness practice. You've been out there, a yoga teacher that's been out there for a while, knows the body, but you can jump into these specialization courses if you wish. And that 1-year course is also $4,499. Lisa, yes, that digestion course is the Masters of Digestive Health 500-hour program. That's what I was referring to. So we have 3 courses there. The Mastering Ayurvedic Digestion and Nutrition, the Ayurvedic Herbalist course, and the 2-year Fundamentals course. Great. I see Ashlyn is putting some links in there to the Herbalist course and some of the other courses. You can check out our courses online. I'm going to post that sale, that discount, $1,250 discount on the course. All these 3 courses here: Fundamentals of Ayurvedic Medicine, the 2-year counselor certification, the Ayurvedic Herbalist, Master Ayurvedic Digestion. If you register anytime between now and tomorrow at midnight, I will give you that scholarship. So when you see there, when you click on here, I'm going to post it online in just a minute, but it's already active. So if you know you want to take the course, you can register right now by clicking on this register now for $250 a month. And you can also register with the, hold on, let me log out of my account here so it looks the same as what you'll see. Give me a second here. I got all these windows open, so see if I can log out without, there we go. Okay, there we go. Now I can look at that page. All right, so yeah, you can also pay with a $600 deposit or the $250 a month plan. The $250 a month plan does not cost you anything extra. It just breaks up the payments so that it makes it affordable for people. About the price of groceries, your weekly grocery bill per month, you can get a whole education. It's just pretty awesome. But you can also get the pay by deposit here. There we go. Register with the $600 deposit application fee if you like. So 2 options there to register on any of these 3 courses. And I am available to talk with you about your plans or questions about education. If you'd like to reach out, if you have some questions, I'll put my cell phone number in the chat box here. John's cell phone. Just text me right now if you have some questions and I will get back to you. It's a big decision. I know you have it's a 24-hour special discount that we're offering. It's the biggest discount we'll offer this whole year. And so people might, if you're interested, they may need to talk to someone. And I know it's a big decision. I will help you determine whether the decision is right for you. I talked to one student and we found out that their real, love in life was to be a Montessori teacher. That person didn't take our course. The other person, we determined that, yeah, this is a great fit. Jump on board. Come learn with us. I can help with that. I do career coaching for our students, our graduates, and our prospective students. And I'm happy to help talk with you a little bit about what the vision might be. A lot of times people don't know how to use their certification, or they have a spouse that's like, okay, how's this going to help our family, right? That those questions are important questions to answer. Maybe you're wondering how you could fit it in with your life. I can answer and help answer those questions and help you answer those questions to other people who might have questions about your plans, how to make sense of it. There's a really great link. I don't know if Ashlyn or if Ashlyn's still on. I think she is. But there's a great link for on Joyful Belly for developing your Ayurveda career business plan, so that we can help you develop that vision. If anyone's interested in that, we can provide that link. Okay, yeah, you'll share it. Thanks, Ashlyn. Yeah, I think it's really important for you to know how to put together a vision for your success. If you're going to, study in the course, and you want to make the most of it. And so every one of our students has that same question as you, and we help them answer it and help them get on their feet. So yeah, so we provided all this information to you today. We're excited to do it. We're excited to talk to the world about the relationship between these hormones. I just want to say that, like, look at this. It looks like a page and a half, right, of information here. We spent a good 2.5 months of research putting all this together. It's a funny thing, right? It's a mark of a great teacher that they can take lots and lots of complex information and interpret it and bring it down to something simple. Now, I would say that today's presentation was simple, right? We threw around a lot of new words for some people, and there's a lot of different hormones. There's like 6 different hormones, or so it's not like it's necessarily simple, but if you were to do this research on your own, it would take you several months to get to this level of clarity on it. And that only if you have lots of training. And that is what we try to do at Joyful Belly, is take this complex information, bring it down to something digestible for everyone, not just our students, but our clients as well, who are going to be doing the work, right? The clients are the ones that do most of the work. So we aim to empower those clients with the information they need, and our students also, and make this information accessible. So I appreciate, one of the great things is that you showed up today. Like, what a great thing. People say that disease is contagious, but health is also contagious. That you showed up today and learned about this complex interaction between all of the different hormones is information that you can use for the rest of your life to help yourself, others, people in your family, and health. For that reason, health is contagious. It's for the whole community. It's a great thing that you're doing, even if you don't come into our course. Whatever you received, is for the world and for everyone. So I hope that you put it to great use, and I hope it helps you. And I just want to thank you for taking that interest as part of our mission. You're contributing, even if you just share with one other person things that you learned, you're contributing to our mission of a healthier world. I appreciate that. And I look forward to our next talk together. We're going to give you another talk in early January on ADHD, just a month from now. So stay tuned to that. That's going to be a great talk given by one of our graduates who did 3 years of study with us. And she's also a medical doctor that's been practicing for I don't know how many decades. She a lot of experience, very awesome doctor. This is a doctor that you want to see. So we'll be sending out details of that as we move closer to the date. So stay tuned. All right, everyone, have a great rest of your day. And I'll stay on. If anyone has any other questions about the course or anything like that, I'll stay on for a few more minutes. Thank you, everyone. I'll post the replay on the YouTube channel, Laura. So check it out on our YouTube channel. I'll try to get that posted as soon as this recording gets processed. Should be by tomorrow morning.
Hey, John, it's Lisa. I sent an email to you today because I was just made aware of some Montana state licensure.
Oh, yeah, that's right. Yeah, licensing. Yeah.
And I don't need to take the time here, but I'm just concerned about how I've been practicing, and I wasn't ever aware that there was such a thing out there. So I just wanted to chat with you about
that. It's a great question. And it's a great question for anyone who's interested in studying Ayurveda to stick around and hear if you're interested.
Okay.
So thank you for bringing that up. In general, none of us are medical doctors. Doesn't matter what state you live in, right? If you there are some states that are called health freedom states, where you have a little bit more leeway as a health and wellness practitioner. But anytime you tell a person, take this food and your cancer will magically disappear, you're creating a liability for yourself. So so we tell all of our students not to talk like that, and that's great. We get to be humble, right? And not use that kind of language. I'm very uncomfortable with that language, even if I had total legal ability to prescribe and diagnose. I think that that kind of language has a lot of hubris in it. Who among us can say that if a person takes this, that they're suddenly going to be healed? That's not the way I want to run my practice. And I never have run my practice that way. Instead, I'm an educator and our students are educators. And that is what we approach. You notice today when people were asking me questions about different diseases and disorders, I pointed them in a direction. I did not tell them what to do. Does that make sense? And I didn't, and of course, if we're in a consultation, then I will be able to get much more specific about how I could, where they could, improve things. But we're not going to use the language of take this and your cancer is going to disappear. That will get you in trouble in Montana and any state. Ayurveda is an unlicensed field, as you know, so there is no license to authorize you to tell a person that something's going to heal their cancer or their diabetes or their PCOS or anything like that. What we can say is that, oh, this herb is an aromatase inhibitor, and aromatase inhibitors work by, in the following manner. And that is why they are often used to reduce estrogen. This aromatase inhibitor is cooling and light. And your constitution is, heavy and overheated. So this one, sounds like it's a good fit for your constitution. But you notice nowhere in that did I say, if you take this, your estrogen problem will be solved. Does that make sense? So Lisa, how you talk, basically, if you follow the rules of being humble about it, you're generally going to be okay. But we also, it's also important, that you don't call yourself a medical doctor at any point. You can say you're a health coach. You can say you're an Ayurveda health counselor. You can, say all those things, but you can't say I'm a medical doctor or, hey, call me, Dr. John. No one calls me Dr. John. I never, sometimes people do, but not because I tell them to. They may just call me that, but I don't encourage that. What I encourage is that the client and I are figuring out what's, what are the good ideas? We're figuring out all the good ideas, but the client has responsibility for their choices, and that's, that's our legal situation. But that's also, I think, the most virtuous way to practice. Yeah. So that would be my long and short answer, Lisa, to your question.
Well, I think where it's getting the lines get a little crossed or confused is like a dietitian is addressing, say, diabetes with specific diet, prescription for a specific diet, where we as Ayurvedic wellness coaches are, like you said, we're just recommending, or we're just not recommending, we're just
educating. We're educators
about their constitution or whatever. Yeah. Okay.
Yeah, your constitution appears to be kapha. Your Western doctor diagnosed you with PCOS. Here's an herb traditionally used to reduce estrogen. If you take a look at the page on Joyful Belly about this, for a constitution like yours, here's how one would take Chastri, or how one would take Ashoka, and then I'll tell them 2 teaspoons 3 times a day, and give them all that information. They choose to take it, and I give them all the reasons why that may be a good fit for them, but I don't tell them that that's going to fix their medical condition.
I think one of the books I got from you it had like consultation forms and different intake forms. I have that book, and I think now that I remember, I think it's been a while since I've looked at it, but I think you address it, how to appropriately and specifically word it to keep
Absolutely.
humble. And yeah, so now that you say all that, I'm like, oh, I have that book. Thanks.
Yes, yes, you do. Yeah, all of our students get the information they need to the guidelines to know how to practice and not get in trouble with, not have legal troubles, or to create false expectations in our clients.
And thanks for doing some of your tips and other programs out there on how to launch this career. I've just kind of been stuck in a little hamster wheel since I got the program, and trying to move that forward with my yoga and my massage practice. But it's slowly coming, but I'm also in a different place in my life to be able to move that forward. So thank you for sending out those tips and whatnot.
Yeah, you're welcome. You're welcome. Lisa's talking about the series of YouTube videos on our channel for setting up your business to be successful, and you can see that on our YouTube channel. We also provide lots more to our students on that level. For all of our programs, by the time the student graduates, their clinic is set up. We offer them an online clinic. And Lisa, that may be, I don't know if that was there when you were a student, but it's there now. We offer our students an online clinic where they can set up their services. And so they go through the whole exercise of creating their clinical practice. Their clinical practice is actually up and running, and they are in practice before they graduate. So they just keep doing what they were doing after they graduate. And so we walk our students through that process. And I think our students find that very helpful.
Wow, I'm sorry I missed that. I'll figure that out. We'll talk later.
Yeah, we will. You can reach out to study@joyfulbelly.com, the student support, and that way they will answer your questions more quickly than me, which is always the issue of trying to run the company and answer every question. I do answer every question, but sometimes it takes me a little longer. So they can you can reach out to student support even to get access to that. All right, let's check the chat. Anything else? Any other questions pop up?
Hi, John. Can I
Yes.
ask a question?
Yes.
Thank you. Thank you for all the information. And
Oh, you're welcome.
I'm just curious about about the abortifacient.
Oh, I'm sorry. I couldn't
Herbs.
understand that. Say that again.
Abortifacient.
Abortifacient. Yes. Mhm.
Abortifacient. Yeah. Sorry. How would you approach those herbs? Would you use them as contraceptive, or would you rather stay away from them? Or
I think that the contraceptive herbs in Ayurveda can reduce fertility, but I wouldn't rely on them if you really don't want a child. And the abortifacient herbs, I would not use them for an abortion. I think that abortifacient herbs, they could lead to partial abortions that could really cause problems. So I would not use herbs for that purpose.
okay, thank you so much.
Yeah, welcome. Yeah, I'm not going to say that there isn't a highly skilled practitioner that couldn't probably, do that. I'm not going to say that can't be done or whatever. I just think that's risky business, because a lot of these abortifacients are emmenagogues and strong oxytocin herbs, and they're just not quite. I think it'll be problematic. Yeah.
Thanks.
Yeah, you're welcome. All right. Have a wonderful rest of your evening, everyone. And we look forward to reconnecting in early January on that ADHD presentation. Take care.